Hi everyone, good afternoon. I hope you are in a healthy situation now during this, hopefully at the end of the pandemic period, and hopefully it's finished now. And now on July 27, today, we will have a discussion during SLEvA webinar about meal in emergency. Just as a note that meal here is not a food. Avianto Amri then will explain about this kind of issue, but for introduction, maybe I can give you such a spoiler about what is a meal. Meal is monitoring, evaluation, accountability, and learning. So the other A and the A and L will be explained by Anto during this discussion. But before it, I want to introduce who is the speaker now. Mr. Avianto Amri is the PhD for Maguire University, and now he is a chairperson of Indonesian Society for Disaster Management, and also a CEO of Predict. Predict is such not a company, but it's an NGO who are concerned on the disaster issue for children with some of education tools, education toys. Later, Mr. Avianto Amri will explain about that also. And before Avianto Amri explain about the meal and emergency, now I pass to Benedictus Dwiagus as chairperson of InDEC, Indonesian Development and Evaluation Community. Dwiagus, hopefully you already ready now. So pass off you.
Can you hear me, Sita?
Yes.
Yeah. Good afternoon, everyone. I'm sorry I'm in the middle of something here, so I forgot to. I cannot use the background, but I'm very honored to open this webinar. I'm very honored as well to be collaborating with APEA and SLEvA, and I'm happy now having Mr. Anto here as a resource person delivering this webinar, which is quite interesting topic because we noted and we understand that the M&E discussion, M&E course or monitoring and evaluation discussions on this very important topic is rarely happening. We never touch issue about the M&E in the emergency context, while we know and understand that the Indonesia has a very unique situational where there's so many disaster risk area here, and we would love to engage more people working in the disaster management or emergency context to be part in the M&E. So yes, so I hope I can continue the collaboration with Mr. Anto, who is representing the Indonesian Disaster Emergency Society or Disaster Management Society, and encouraging or promoting M&E in the emergency context. So over to you, Sita.
Thank you, Dwiagus, for a quick speech now. And now I direct pass to Avianto Amri. Please.
Okay, Thank you very much, Mas Sita. Can you hear me?
Yes, clearly.
Okay. Good afternoon, everyone, and maybe good evening for some of you. Or I don't know where our participants are coming from, but thank you very much for joining the meeting. Assalamualaikum warahmatullahi wabarakatuh. My name is Avianto Amri, and I'm very pleased and honored to be participating and also sharing what I have learned so far in the M&E field of, or Mas Sita called meal. It's not just about distributing food, but also about monitoring, evaluation, accountability, and learning. My screen has been disabled by the host. Can someone help me with?
Now you can share.
Yes, fantastic. Thank you. So, meal, monitoring, evaluation, accountability, and learning. In the past few weeks in Indonesia, actually, the word accountability is actually quite trending among the humanitarian agencies in Indonesia, because there was an investigative reporting on one of a large humanitarian organizations in Indonesia, local organizations, but they have widespread coverage or national reach. That apparently there were some misuse of funds and inappropriate programming and etc. So in the last 2 weeks, we have been also providing press releases, talking with the media, and also right now we're in the process of advocating for the government for stronger regulations, which is interesting from our point of view. The regulations of that's related to public donations or public funds for humanitarian sectors is actually almost 40 or 50 years old. Meanwhile, in Indonesia itself, disasters is like a daily occurrence in Indonesia. We have lots of emergencies happening, new emergencies happening every day, which I will also share in my slides. And that is why these 4 words, these four letters, is very important for us. We feel like agencies need to have a better or stronger system to make sure that they can implement or deliver humanitarian responses in a transparent, effective, and accountable way. So let me move on. Just a quick information about myself. Mas Sita already mentioned that I have a PhD. My topic is about household preparedness with children, which is interesting because from my journey or my experiences is we have been used to talking with children, communicating and working with children. That makes us challenged to be able to communicate with the people that we are working with in a simple and easy to understand ways. So I think that's the spirit that my organizations has been also trying to use, meaning that in disaster management world or in humanitarian sectors, things can be easily lost because of the terminologies, the jargons, and everything. And I think one of the things that people tend to go to us is because we can make complicated matters becoming simple. So I think that's also one of the things that we need to make sure that how we can present our reports, how we can present our analysis, making sure that the findings and the recommendations are sound, but also for people to easy to understand and to internalize and follow up. My experiences, I work with many UN agencies, the ASEAN Secretariat and the HA Center, international NGOs, and also I'm currently working with UNICEF in the Pacific region, helping with countries like Fiji, Vanuatu, Kiribati, and other Pacific countries. Can those help me with the muting on that? Thank you. And also obviously working with Indonesia as well as in the Southeast Asia region. So moving on, just quick information on the Indonesian Society for Disaster Management, or MPBI. It has been established for 20 years, and it is a non-profit. I'm sorry. It's a non-profit organization, a platform for individuals, practitioners, government officials on disaster management. We are a member of the Humanitarian Country Team in Indonesia, part of the alliance called Indonesian Development and Humanitarian Alliance, and as well as the Asian Disaster Reduction Response Network, or ADRRN. We work closely with government agencies, and I think what's also relevant here is that we are the country focal point for INEE and SLEvA. These two are global standards in the humanitarian response, and our roles is to promote agencies working in Indonesia to use these standards in their designs and implementations of humanitarian response. Sita also mentioned that my company is called Predict, and we're working with children. We develop board games, IEC materials, creative tools for children to engage with their parents on disaster preparedness education, and we try to build household preparedness that is scalable and sustainable. So moving on with the theme of the day of this webinar. So right now, Indonesia experiencing about, I think, almost 4,000 disaster events every year these days. What is interesting is that the trends is getting more frequent, more intense, more widespread, more unpredictable, and more complex as well. We've seen many areas that were, because of climate change, environmental degradations, poor land use planning, or rapid rate of development and infrastructure projects, many areas that used to be not prone to emergencies and not prone to disasters, and now they are becoming more prone for something like floods, landslides, or other hazards. We think that this is more dangerous. This is more complicated because people who frequently exposed to disasters, they tend to be able to build their resilience over time. So if you see, for instance, like people living in nearby the riverbank, for instance, in Jakarta, or people who used to be struck by floods, they're growing their coping mechanisms. They build their capacity to make sure that they can adapt and adjust their lifestyles as well. But these days, because the changes has been happening so dramatically or so rapidly, people were not prepared at all, and this is becoming more intense. So this is just some of the figures that we have obtained, and this is during the COVID-19 pandemic. Since 2020 to 2021, there was many floods, there were many earthquakes or tropical cyclones. Many of these disaster events have the same situations where in many emergencies, there were lots of humanitarian agencies mobilized, as well as hundreds and thousands of personnel being deployed. And from our records, at least almost 300 agencies are working in the humanitarian sector, with a total of maybe around 200,000 to 250,000 humanitarian personnel and volunteers. Because in the figures that you're seeing in the screen, it hasn't include also volunteers from the Red Cross, from the government's agencies, and etc. So we believe that the numbers is even higher. Okay. And this slide, what I want to show you is the two boxes in the red square. This is an infographic from the recent volcano eruption that happened early this year in January. This called a Semeru volcano eruption. What is interesting is that the number of people affected is about 10,000 people-ish, which is that figure is fairly medium scale, not a large scale emergencies. But the number of the agencies responding and the number of people deployed was very large. So almost 4,000 personnel that were recorded to be in the affected area. Meanwhile, if we're looking at the people, the aid workers to the affected people's ratio, so it's about 1 to 3 per, so 1 aid workers for 3 affected people, or 1 to 2.5. So this is a very large ratio, meaning that the positive side is that there's so many high solidarity. There's a lot of interest and motivation for people helping each other, but also it raises the questions of how accountable of these organizations, how competent is the personnel that were deployed, and also what kind of monitoring and evaluation systems are in place to make sure that the humanitarian response or the disaster response activity is up to standards. So that's why this is a challenge for us as a community of practitioners to make sure that the M&E systems is working and agencies are accountable on the response programming. And as you can see, well, this is just a quick run through on how we have like data that where we can use it as informations, and then when we connect the dots, it becoming knowledge and insights for us. And then if we can see the linkage, this is becoming the wisdom. So this is how this is an easy visualization to differentiate between that. Why did I put this slide is because right now, because of the availability of technology, everyone is using gadgets. I saw in one report that we are living in a generation where everyone is recording. It's such an easy way where people just 2 or 3 clicks away to record the video or post something, so that there's a lot of data available in everywhere in the digital platforms. But what is useful is that we need to find which one that is relevant and and how we can use that as informations, and then going through for knowledge, insights, and wisdom. And this data, information, and knowledge, we use it for the management cycles, to design interventions, to find directions, and for decision-making process, of course. Now, looking at the meal component itself, when you have inputs, those inputs, for instance, like we distribute tarpaulins, we distribute tents, foods, school supplies, and that goes into activities where we make sure that the relief aids goes to, and being received by the affected people. And then we measure what are the outputs, the outcomes, and the impact. I took this from the SLEvA training course, where monitoring is where we assess the activities and the outputs that has been done or not yet been done. And then evaluation is about measuring outcomes and impacts. Meanwhile, accountability goes since the beginning towards the end. So agencies are accountable for every aspects of the programming. every inputs, every activities, and then all the way to the impact. And that's also applies to learning as well. Sometimes people think that learning starts when they're doing evaluation. But of course, learning is not just starting from there, but also even if since the beginning, we always have that continuous learning process. And that's where MILS comes in. Having a good monitoring system in place, having a good evaluations, having a strong learning system. That means we have the ability to have a comprehensive look on what's the situation is, what's the weakness, what are the strengths, what are the things that went well, what are things that not going well, and what we can do to improve. It's similar like the blind man trying to identify the elephant. Now, I'll do this briefly on the OECD DAC criteria because I think we are among committee of practice who have lots of experience in monitoring and evaluation. So I think the standard criteria that people use is these 6 criteria: coherence, effectiveness, efficiency, impact, sustainability, and relevance. And you can see the explanations on the screen. But also, the other, sometimes when we are doing evaluations, the project owner or even the donors ask additional criteria. And these are the 6 criteria that we had encountered when we done evaluations, I think in the last 3 years, probably, especially after the 2018 Central Sulawesi earthquake and tsunami responses, as well as the Lombok earthquake response. So first, innovation. We had a client who want to specifically see what kind of innovation that exists, or are they doing innovative enough? Are they providing different methodologies that is more effective, maybe more providing more impact, giving more benefits. So the criteria of innovation is looking at how we compare the process of this agency that has undertaken and then compare it with the other agencies. That one. The second one is about localizations. This is actually quite a trending themes. If maybe 5 years ago the buzzwords are resilience, if 10 years ago the buzzword is about sustainability, right now these days lots of people, lots of agencies are talking about localization, which is interesting because localizations and in Indonesian language is actually not really a positive meaning, because it's called but from going back again, the localization is about how you empower how you deliver your response programming as local as it can be, meaning that how you can empower the local agencies, the people on the ground, the communities, as well as with the other organizations. We have been discussing quite a lot with on localizations, and at least there are 6 types of localizations. You have in Indonesia, you have international organizations, then registered as national entity, and then they are doing the implementation by themselves directly, and that's how they interpret localizations. You have organizations then building long-term partnership agreement with local NGOs across Indonesia. And then the implementation is being done by partnerships. That's another way they interpret localizations. You have the Red Cross model, where a lot of the national societies have Indonesia. The Red Cross have offices in every district and municipalities in Indonesia. So they think that there is maybe less needs to partner up with other organizations because they have people on the ground at the local level. So that's how they interpret localizations. If we're talking with the UN agencies, the UN agencies say that, well, we are working with the government and we're supporting the national government, helping with the subnational and local government. So that's where we comes in and how they interpret localization. So there's so many models of localizations, and we can discuss this for a long time. But I think one of the things that that I conclude is that there's not going to be a one-size-fits-all approach for localizations. But I think the key thing is to have that. What are the golden standards of localizations? What kind of factors that needs to be considered to make sure that the commitment of empowering local agencies, empowering local communities can be done effectively and also as per standards. The third point about GETC, or gender, disability, and social inclusion, is a component where you see the gender elements, how access and barriers, especially for people with disability, as well as recognizing groups in the communities to see if there are no ones left behind, or if there are marginalized groups that need to make sure that they also receive assistance. The fourth criteria, building resilience, is also a training topic, saying that you cannot just deliver emergency response, but also you make sure that there are linkages between response, recovery, and development. How building back better approach needs to be taken into account. How people can bounce back quickly, and also recognize that hazards often comes in periodical cycle. So it can come again in 5 years times, or 10 years times, or 100 years time, or even next month, or even next year. So that means that how the humanitarian assistance that being implemented can also build their resilience, and then they can better cope with hazards in the future. The last two, coordination and complementarity, is also recognizing that there is a need to coordinate, not just about sharing information, but also how you mobilize resources, how you complement activities with each other, and also to recognize that there are others who is doing response, and there are others who you can work together to amplify or to increase the impact of that one. And lastly, this is also a trending topic in Indonesia these days, which is about community engagement and accountability. And this is how we interpret, how we communicate with communities, how we participate, and then also having a feedback mechanism to make sure that people can provide their opinions, they can share their thank yous, they can ask questions, they can check to clarify why they are not in the list of the target beneficiaries, or why they are in the list of target beneficiaries. But also to give critics, give feedbacks, and this feedback mechanism has been evolving over time. We've seen a lot of agencies working with different tools, really interesting methodologies, starting from providing a suggestion box, or having a help desk, and also providing surveys, doing workshops, consultation workshops, or even using the ITs. We've seen agencies using chatbots, so they can share it through WhatsApp groups, and also through social medias and etc. So this is something that's a lot of advances and tools that is being developed in this area. So what meals means to us is about how you engage with the communities. How it's not just about accountability to the donors, but also how you're accountable to the people who we seek to assist. We ensure that it has meaningful benefits, not just for reporting or compliance. It's about proactively seeking opinions and feedback, and then also how to use that to adjust for your implementations, how you adjust your programs to make sure that you can strengthen your interventions or creating more bigger or lasting impacts. And also also to see whether there are standards at the national level, at the sub-national level, and of course at the global level. So these things need to be assessed whether standards are being upheld, and then also if it's not being upheld, what's the reasons, what's the weakness, and how we can improve from there. One of the things that I want to also share with you is about Loop, where you have a really interesting tool, an online tool, which is anyone can access it, and then you can share your feedback from that. You don't need to register. It can be done everywhere, anywhere, as long as you have an online access. So the website is www.talktoloop.org, and then you can use Loop to share your opinions. You share your stories. And right now, it is available in English in the Philippines, Tagalog, Indonesia language, and also it's being used for responses in Somalia, in Ukraine, Indonesia, and many other countries. So if you want to change the language, you can just use, for instance, like let's use English, and then it automatically translates the platforms, and then you can just share your stories. So everyone communities can share your stories to share it. So let's say I'm right now delivering webinar with APEA and SLEvA colleagues, and we are talking about meal in emergency this afternoon. So you can keep going to the story, and then it's immediately check whether it's a sensitive stories or not. What is a sensitive story? Sensitive story is about things that related to sexual exploitation, abuse and harassment, child protections, corruption, fraud, and the other misconduct. So this is also something that people can report if there are cases of sexual exploitations and violence or corruptions and everything like that. And the process is also different if we're processing the sensitive stories. This is just an opinion. For instance, if you want to say thanks, if you have questions, if you have a concern, you can highlight that. And then if it goes next, you see it automatically detects your locations. Where is the location coming from? You can see Jakarta, Indonesia. And then to whom organization it goes to. For instance, like my organization, MPBI, for instance, the Indonesian Society for Disaster Management. Can put that. So if this process gone through with everything, the focal person of that organizations will receive an automatic email and then notify them that there is a story about your organization, like that. So like that. And then if we post it, then it will go to the server and then process, and then it will be shown online on that. If it's a sensitive story, Loop do not publish it online, but then Loop then process it through referral mechanisms, and then there's procedures involved to make sure that the person received the suitable responses to that. So that's just a quick overview. This is, if you look at the website again, there's lots of stories talking. Here is colleagues from Zambia. There's people in the Philippines, and you can also differentiate, filter it in your location as well. So like that. I'll move on to my slide again. Okay, so that is one of example, or one of the alternative feedback mechanisms. It's safe. It can be used anytime. It has a direct reply feature, so the focal point of the organization will be able to reply directly to the stories that tag or tag his or her organizations. It's available on website, on WhatsApp, and Facebook Messengers in Indonesia. So these are, as mentioned before, it's part of the community engagement and accountability, where the purpose is to have community participations and feedback mechanisms. It also recognizes that information is aid. Information is also helping the people are being affected by disasters. Information, for instance, like where are the distribution centers? Where are the evacuation centers? What time is the distribution for tarpaulins? Or when is the school starting again? We've seen also from the learning of the pandemic response of COVID-19, information is crucial to know which areas that is a hotspot, lots of infections or disease transmissions. We've seen also behavior change communications, which is on point number 3, on, for instance, like awareness raising about the health protocols, using the mask, clean your hands with soap, and also safe distancing. And then the last component is about evidence-based advocacy. So engage with the communities, and then also to make sure that their voices are being heard, so that assistance can be accountable and more effective. So moving on, I mentioned earlier there's a standard called SLEvA. This is what it looks like, the book, the SLEvA handbook. And in the humanitarian sectors, we have core humanitarian standards, which is 9 standards. And one of the examples, I just show you, I just screen captured this in small part of the book, saying where, for instance, in the water, sanitation and hygiene section, it outlines what is the standard, what is one of the standards here. I captured access and water quantity for wash. It has the recommended key actions needed to achieve the standard, and then also the key indicators to know where are the progress, or how the standards is being achieved. This is particularly useful, especially from every time I do evaluations, because or even designing proposals, designing programs, because I can easily develop monitoring framework or research framework to check which indicators that I want to use and which one that I want to monitor closely, and then which one also that's relevant for the people receiving the assistance. That one. So SLEvA has sections on the core humanitarian standards, the standards that applies to all humanitarian responses, and also have technical sectors for shelter, health, water, sanitation and hygiene, as well as for it blanks my mind. Shelter, health, wash, and I'll come back again in that. Yeah, let me check on that. But also, aside from SLEvA, there are lots of standards available. You have here is the minimum standards for education, so for INEE. This is standards for education response programming. We have like child protections, for market assessments, for older people and people with disabilities, economic recovery, even livestock also have standards if you have a response. And then like that. Okay, so common challenges during emergency response.
Sorry,
right
Anto.
Yes.
Time is.
I'll wrap up the webinar.
Okay.
So
thank you.
we have so the common challenges is a tsunami of data versus no data at all. So right now it's not about we don't have any data, but data is abundant. So there's lots of information going on, but how we can select that data to have proper analysis, also to see which one is vulnerable, are at risk, children, older people, male and female. But also in the situation of COVID-19, we have like people with comorbidities as vulnerable groups, and also with competing assessment with other agencies. I think I'll skip this part. People can learn from the presentation, but I think I want to highlight the situation and challenges related to meal and emergencies, where usually data is not well documented, information has been too long to remember. There's lots of turnover, but also what is interesting is sometimes in Indonesia, or many times in Indonesia, is that there's no time for learning, because once you have finished your programs, then suddenly there's another emergency that you need to be deployed. There's a lot of so many things that are happening. It's just so difficult to have a peaceful time to reflect, to internalize, and then make changes in that plan. The other systemic change is, of course, lack of motivation to learn and change. Reporting process is too complicated, so it becomes a burden. Lack of capacities and lack of resources. I think I'll stop there. There are 2 slides that provide resources, interesting resources on evaluations, especially for humanitarian sector. And thank you very much. Back to you, Mbak Sita.
Okay, thank you very much, Anto, for a great presentation. And now I think because we have very limited time, we go to the question and answer. I think I already sent you the link. If you got it, Anto.
Oh, could you share your screen, Mbak Sita?
I sent through the chat room. But okay, there are 3 questions. Yeah. First from Fayaz and from Pranila Teraparaja. Sorry for my spelling. And Sakawat Hossain. From Fayaz, the question is about how learning can be generated in the meal. And for Pranila, how does the meal differs from emergency and development context? And from Sakawat, in emergency situation, how we will ensure accountability to the affected population, especially for any kind of NFI and FI distribution.
Yes, thank you very much, Ms. Sita. And I'll start with Randika first, and sorry, Fayez first.
Fayez.
It's a really interesting questions. I think I showed that in the last slide. There are sometimes challenges on how you incorporate learning, but first of all, learning needs commitment. It's an agency commitment itself, or at least an individual commitments to change, to use the reflections, the evaluations that you have received, if it's being done by others, and then try to improve. Learning also takes time. It cannot be done instantly, I think. So it needs our brain needs to digest, need to have a good space to relax and then see how we can improve. And I think from the slide itself, when you see the result-based monitoring visualizations, you can see that learning is not just about doing it at the end of the program, but also how you can incorporate learning when you are implementing the project, when you are monitoring the progress, and also when you are evaluating the program. And I think last, learning need resources, but also how you pick and process and analyze the information that you got. It turns into recommendations, but recommendations also needs to be practical. It needs to be strategic. It depends on who you are targeting the recommendations, so that learning can be done, can happen, and that needs also a consideration of resources, whether it's funding, whether it's people, whether it's culture. I think those three are some of the elements that can be that can influence learning, and that can be generated in the meal system itself. You get information, you get data from monitoring, you get information coming from evaluations that needs to be processed in a way so that we can learn. So that's the first question.
Yes.
The second one is vanilla, right?
Yeah, vanilla.
Thank you very much for the questions. How does the meal differ from emergency and development context? Yes, I think in emergency, sometimes we don't have the luxury of having enough time to do baseline. So maybe if it's peaceful time, when you're starting the project, you can have a proper baseline data, or you conduct a baseline assessment. But in emergency, the time element sometimes gets shortened very quickly because you need to implement it. You need to deliver the response, right? So the time element affects many things. Of course, it causes shorter time to design, shorter time to make sure you can have like a proper consultations with the committees and with the government involved. Shorter time to gather data. But I think from what I've seen with different organizations, the level of preparedness makes it very different. If your organizations are well prepared, you have competent people, you have diverse staff with diverse skill set, and they know what to do during the first times of emergencies, that really helps, especially in making sure that you have the right baseline information and help you guide in designing your programs. The other things with the difference is that in many times it's also lots of turnover. I feel like in emergency response programming, things can change can change very quick, and also that also includes staff, and staff retains information, retains knowledge, retains backgrounds on why they do the design, why they implement the projects, and that makes it difficult for instance, like for an evaluator to chase or to find people who has been working like 2 months before during the emergency phase. And I think the third bits that maybe I want to share is in emergency response programming, you often have like the shelter project is being run, and then you have the WASH program, you have the educations helping with the kids to learn from and reconstructing schools. You have, for instance, like psychosocial support for people being affected. So you may, in one organization, maybe you can have like 5 or 6 programs happening, and these programs sometimes can be starting in different timing and also ending in different timing as well. I had an evaluation in one of the organization where the SELTA program has been finishing like months ago or even years ago. But then they still have the WASH program running. They just started with the psychosocial program that's happening like 3 months only. And so it's that dynamics is it's really interesting because we have to dig up files, we have to check the reports and documentations because the overall evaluation also need to cover, for instance, like the SELTA program that finished many months ago. So I think that's can be maybe that's some things that makes a difference between emergencies and development context. So that's the second one.
The third question. The third question, Sakawat Hosan, in emergency situation, how we will ensure accountability to the affected population, especially for any kind of NFI and FI distribution. And Sakawat also respond in the chat room about that the after action reflection might be one of the process of learning.
Yes. If the host can help me with sharing my screen again, that'd be great. So
the time is already.
No, almost. I mean, there's another slide that. Thank you very much, host. So this is one of the slide that I skipped, but thank you very much, Sakawat, to say that. So there are after action review. This is something that usually happens. For instance, like after an emergency response team being deployed. So you have like a month of deployment. You deliver your NFI distribution, you deliver your tents, your school kits and everything, and then you finish the mission, and then you do the after action review. It's a quick and dirty assessment, looking at what things that went well, what are things that needs to be improved, and how we can what are the recommendations in the future. There are also other things that like real-time evaluations. It's really interesting exercise where you do evaluations during the project implementation. So that kind of evaluations is really helpful to know whether you are on the right track, whether it is using the right approach, and also it helps to guide so that it can be in the right direction. And I'll of course this is common for the midterm and final evaluation on that. So yes, thank you very much, Sakawat, for the for highlighting the after action reflection or after action review. Then we go back to the third question, accountability of the affected population. So on accountability of the affected populations, especially you're talking about NFI, or you're talking about distribution, there's many agencies which is now a common practice where they do post-distribution monitoring or PDM. So the post-distribution monitoring is when you do distribution of, for instance, like blankets or mats or tents and everything like that. And once you finish your distributions, usually the common methodologies to do this is through a survey. So you recruit enumerators, external ones, and then they visited they do a sampling of the populations that get distributed, the relief items, and then they do like a satisfactory survey whether the items are being used, whether it's useful for them, whether it's appropriate, whether it's suitable for their context, and etc. Of course, there's lots of methodologies in doing a post-distribution monitoring. You can do it through FGDs. You can also do interviews. As mentioned before, there's these things also as part of the feedback mechanism process. You can use the Loop website to share to collect feedback coming from the communities, suggestion box and everything like that. But again, It's an interesting question where accountability starts since the beginning. It's not just about an post distribution, but also accountability means that you consult with the communities beforehand. You talk with them, you sit down, and then see what are the best way to help them, and also how they can also help themselves, how they can recover quickly. And I think that's part of the accountability. It's how we empower people. And in many times these days, or at least I can talk about the Indonesia experience or Indonesia context, is that people can recover quickly by themselves. It's a matter of how we can fill in the gaps, whether it's a technical issues, whether it's knowledge gaps, whether it's the information gaps, but resources are sometimes available, and how they can use the existing resources or the local resources to make sure that they can recover quickly and insufficiently by themselves. So yeah, I'll stop there on the third question.
Thank you. Actually, we have two questions, but unfortunately that the time is very limited and we need to close this webinar. But before we close, there is such a closing remark from Pramoda Weerathunga. I'm sorry, Pramoda. Please, time is yours.
Hello, everyone. Thank you, Sita, for the introduction. We are going to end the 30-second SLEvA webinar on meal in emergency. Yeah, I must say that the webinar was very informative and insightful. As the participant, we learned about many things meal and emergency. So I would like to appreciate our speaker this time, Avianto Amri, the chairperson of Indonesian Society of Disaster Management and founder of the Predict, for conducting a very informative presentation on the meal of emergency. And further, I would like to thank our moderator, Sita, for doing an excellent job to engage the participant into the webinar and for your great moderation. It would be really appreciated. And also, not only that, I would like to thank Dwiagus, the president of InDEC, who gave the opening remarks. Then I would like to gratitude to the SLEvA for organizing this webinar in collaboration with mainly Asia Pacific Evaluation Association, EvalYouth Sri Lanka, Center for Evaluation at Jayewardenepura University, and also InDEC. And all other any organization who has been support to success this event is much appreciated. And also mention the production team. As a production team, always staying behind and doing a great and marvelous job all the time. So I mentioned Randika, Madhuka, Punya, Hasiti, and Chamatkara. Thank you very much for your great inputs and for your hard work. And finally, I would like to give a great pleasure to our active participants who engage with today's webinar by allocating your valuable time. Actually, it means a lot to us. Therefore, I would like to invite you all keep in touch with our future works to share some knowledge and improve existing knowledge. Thank you very much and stay safe. Over to you.
Thank you. Okay, thank you, Pramoda. Now we will have next webinar. We will have a webinar on it's about the shifting the power in male and NGOs and communities take ownership of male. You may register in this link. Okay, and then we will have a launch event of Asia Pacific Journal of Evaluation of APEA. So for those who have a good or good experience in doing evaluation, you may follow this launch event, and also maybe you can follow or upload or posting your experience on this journal. But before that, let's we hear this event and then register to this to the mentioned link. I think we, oh yeah, this is the information. Oh, please read and then noting this information. And I think the time now is already off. Then we must closing this. We must be closing this webinar. Thank you very much for your participation, for your question, and also for my friends Avianto Amri for a very great presentation, and for Dwiagus Spantoro, the president of InDEC, and also friends from SLEvA for the University of Jayewardenepura, and for APEA. Thank you very much.
Thank you very
healthy.
much,
Bye.
everyone. Bye-bye.